Welcome everybody to this MDS roundtable. My name is Guillermo Garcia-Manero from the Department of Leukemia at the University of Texas MD Anderson Cancer Center, and I'm very pleased to be here today in this I guess teleconference. The next question is for Tom. That is, in this disease where in clinical trials at least, measuring survival is not usually the primary endpoint because, of course, these patients with low-risk disease, they have relatively long survivals. And as Oli was saying, we're really looking for improvement in hemoglobin, etc. Of course, you would like this to somehow translate into improvement in quality of life and basically the clinical well-being of the patients. I know that this has been challenging to really measure in the context of phase 3 trials, but how do you see this issue of measuring patient experience, and how do you think that these new compounds impact actually this really fundamental phenomenon of what we want to do with these drugs?
Yeah, it's such an important question and a tough one to answer, but I think it's really the most important question, especially if you're the patient. What am I going to feel like, and what will it be like if I do treatment A versus treatment B? And the treatments may not be equivalent in how often you have to receive them, or maybe how long they'll work, or how much they will change the hemoglobin, but they may also not be equal in symptoms and side effects that are caused. So, we always have to have hard endpoints like treatment-free remission, which these kinds of trials are often powered to transfusion independence, like on commands for, at least a 12-week or longer period, or that's getting longer in the trials now, as you know. But for the patients, quality of life also matters. And we haven't always been able to measure this in a meaningful way on clinical trials, not just in MDS, but really across cancer care. European Medicines Agency requires some quality of life assessments and uses these to make regulatory approvals and recommendations for therapies. FDA says that they do it or want to do it a bit more, but it's always felt a bit debatable to me how much value they place in these measures. But even the measures themselves, when they're very well validated measures, things like the EQ5D, that gives you really good overall quality of life data in domains about things that matter to people, like can you do your activities of daily living? Are you having pain? Are you having significant symptoms? You're able to do other things that you want to do to function and to enjoy life. We don't always see clear benefits on those scales in these trials. And yet, when we all are treating these patients, it does feel like we're seeing benefits. So when you see and treat somebody with MDS, and they go from needing transfusions, 1 or 2 units of blood every 1 to 2 weeks, to not needing any blood for a month or a month and a half or 2 months, and the time keeps getting longer, it's life-changing for those people. It may not get rid of their symptoms, and it may not improve their health-related quality of life on a stringent measure that assesses only the things that it assesses. So I really think that we should be devising ways to include measures of things like time toxicity. How often did you have to come to the clinic? How many hours did you have to come to the clinic? How often did you have to sit in the chair for half a day after getting pre-meds and then having to take a nap while you let your antihistamine wear off if you're getting that pre-transfusion, especially for the folks who've had prior reactions? How long did you have to drive? How much did you have to pay in gas money and pay for parking, which I know is a huge problem in New Jersey. It's actually a problem here in Durham too, surprisingly. Everybody has to pay for parking when they come to a big place like Duke, even though nobody would pay what we charge to park in other parts of Durham. So it's a big challenge. It impacts people's lives and well-being. I've been excited to see some new efforts to measure these kinds of things on not as much on big randomized phase 3 trials, but to explore doing a little bit in some early analyses, like these twist kinds of analyses, time without symptoms and toxicity, or other kinds of time toxicity assessments. And I'm hoping we can figure out a way as a community to standardize these and make them part of what we do on our trials, but we're not there yet.